So we're going to go just real quickly go over some myths. This won't take very long. But this is a very common feeling. It's not quite spoken, but it's often understood. Many people feel that the only good medicines for relieving pain and suffering are opiates. Who feels that way? Anyone? A lot of people, yeah, like what else is there? You know, and the reason I think that we do as a society feel that way is because opiates have been prevalent and they have been the mainstay of pain care for a couple hundred years. Maybe going back further if you consider laudanum. I think the Egyptians used laudanum. I don't know. Carl's really old. He'll tell you about the Egyptians. So the answer is false. And as we learned a little bit earlier, opiates can do some real good things in the short term, can do some real bad things in the short term, can do some bad things in the long term as well. And I suppose, just for fairness, they probably could do something, for some people may do something good in the long term. But usually they're problematic. The effects of opiates differ from patient to patient. Again, why it's important to focus on the patient and not the substance. We're going to miss the boat there. Paradoxical effects, very, very patient to patient. What's a paradoxical effect? Well, opiates, when given to someone who doesn't have addiction, causes sedation and makes them uncomfortable, and they don't want to do much, and they don't want to have another opiate. What do you think opiates do to people who have addiction? How do they feel? Great! Extra energy. They want to do more stuff. It's a paradoxical effect. Very different patient to patient. And again, depending on the situation, here's an example. There's a person with opiate addiction who I took care of a few years ago who had a real serious injury. He was water skiing and injured a tendon in the back of his leg when he was starting. It was very painful, and he needed surgery. And he was supposed to come and talk to me as an addiction specialist prior to surgery, but for one reason or another decided not to come in, came in a few weeks later, and he was already on pain medications, which some of them were appropriate at the time. But he was on them a bit too long. And there's what he said I will never forget. He said, you know, after a week or so, the pain was nothing. The craving was driving me crazy. So I talk to patients about that because on one hand, there's this thought I will feel lack of pain, but the downside can be very, very bad for a lot of people. Okay, so true or false? If a patient ever had a substance use disorder, especially to opiates, they should never get any pain treatments. Is it true? False? What do you think? False. In fact, it's extremely important, in my opinion, and I think in the opinion of other people who treat pain and addiction, that patients who have substance use disorder and who are in pain deserve really good pain management. Now, it may be with things other than opiates, but if the pain is severe and the pain is problematic, patients this could easily lead to relapse because it destabilizes recovery. Pain in and of itself can cause the release of a number of neurotransmitters that can sensitize the patient to craving as well. All right. True or false? If a patient ever had a substance use disorder, especially to opiates, they should avoid self-administered pain medications. True. Why? Why? Well, one of the targets of substance use disorder, and this is when you learn about addiction, they kind of dress up these things, the neurobiology of addiction is a profound disorder in decision making. Right? So self-administered means that the person has to decide when he needs a medicine. So people with substance use disorder have a lot of difficulty with that. Many of them do. And even if someone has been in recovery for quite some time, they may need some assistance with that. And someone else should be in charge. Okay. True or false? Pain, whether acute or chronic, mild or severe, should be addressed in patients with addiction because failing to do so can jeopardize their recovery. Right, because you all paid attention to the last slide. It's absolutely correct. All right. Yes, untreated pain, or actually, I tell patients why they need to get a primary care doctor and engage with the medical system is just about any medical problem can induce stress and anxiety that can trigger relapse. And it's really important that patients with addiction, just like everybody, take really good care of themselves and feel comfortable with their healthcare system.